And I'd been having problems for years with intense pain to the point where I had to get prescription medications. I'm a professional athlete. I'm supposed to be able to be strong. That was very limiting. Even have a better tennis career.
I'd say the symptoms are really challenging.
I started to have increasing problems over time with length of menstruation, duration, heaviness.
It affected my career, and I was told that I had fibroids.
Fibroids are benign, smooth muscle tumors of the uterus. They affect 80% of women around the world. Although fibroid disease affects all racial groups, Black women are particularly affected by this disease. So common symptoms are bleeding, pain, pressure, bloating, pain during sex, urinary frequency.
It's really unfortunate that women don't know that that isn't normal. I think I'd had just, troublesome cycles for so long that it was unfortunately my normal. I didn't know I was living something out of the ordinary. So it was a really tough time personally.
Often women don't get the kind of care that they need and deserve because the first issue is they're normalizing their symptoms.
I'd gone and seen someone in 2019 at a different facility, a different hospital, and that doctor had told me that I had to have a hysterectomy. And I knew at that point, having a hysterectomy meant that I wouldn't have had any kind of chance to conceive. So I had a friend recommend that I come and see the team at NYU Langone.
I thought to myself, I want to go somewhere that really knows what they're doing. And so I go online, I start doing research, and anyone that knows me knows that I'm a research queen. And I started diving in, and I found NYU. And there was a whole center, a place that's super dedicated to this particular issue. And that's how I ended up here. I had confidence in the program.
At NYU Langone Health, we have a Center for Fibroid Care. At our center, we make sure we prioritize women's health needs because often women feel dismissed who have this disease. We pride ourselves on prioritizing their life goals and developing a personalized plan with each of our patients. And so we really pride ourselves on a collaborative, multidisciplinary approach.
I'm the registered dietitian at the NYU Center for Fibroid Care. My role is to provide evidence-based nutrition counseling to patients with uterine fibroids.
Women commonly are anemic, and a lot of the times fibroids are the reason why this is happening.
I'll tell the patients our process. We do a triage of their symptoms. We get all the correct imaging that we need in order to help our team of physicians guide them to make the best treatment plan for them.
Hey, how are you? How are you? Good to see you. Nice seeing you. I felt like I was in the right place finally. Then everything changed. My blood count is so much better. I've never had a high iron blood count.
I wanted to have a child, and a year and a half later, in 2021, I had a beautiful little girl. So it was very successful.
It did feel great to be at the right place with the right people, with the right team, and that I could look forward in my life. And first of all, just live comfortably and have options in my future if I want to start a family.
Absolutely.
Those kinds of things make a massive difference. It made a massive difference in my life. And I'm so grateful for you for changing my life and so many other women's lives. And I'm so glad we met.